Welcome to Bonnie's Beat. I'm your host, Bonnie Squires. We're coming to you from Radnor Studio 21 in beautiful downtown Wayne. We're also broadcasting now in Lower Merion over Lower Merion Narberth Television, which is exciting because I finally get to see my show because I live in Lower Merion and I have Comcast as my provider. We like to bring you guests who are doing something really important in the community, whether it's charity, whether it's politics, whether it's academia, whether it's athletics. And our guest today is somebody I know well. Her name is Tanya Regli, but it's Tanya, Tanya, unusual spelling. She's the executive director of the ARC of Philadelphia. Tanya, thanks for coming to the studio.
Thank you for having me.
And the ARC of Philadelphia, there used to be words for each of the letters, ARC, but no longer.
No, it's no longer an acronym.
That's right.
It's just the ARC of Philadelphia.
Just the ARC of Philadelphia.
Correct.
Which is, in 1948, the ARC of Philadelphia, I think, was one of the first organizations that was an advocacy group for people with intellectual disabilities.
Right. The ARC of Philadelphia was founded by parents of children with developmental disabilities who were, at the time, often being recommended to be put in institutions. And so the parents came together and founded the ARC of Philadelphia. It was one of the first, and really there was a national movement at that time. And a lot of the leadership in Philadelphia went on to help build the national leadership as well. So we now have almost 700 ARCs across the country, and in Pennsylvania, I believe there's around 33.
And that makes a lot of votes. If you're paying attention, members of the legislature, got thousands of people out there who are holding your feet to the fire for the state budget, right?
Right. Well, and unfortunately, our community of folks are very impacted by the fact that the budget has not passed. But there's probably, well, of the 700, we're probably the largest advocacy organization for people with disabilities in the country.
In the country.
Mm-hmm.
And you recently were at the national ARC, the ARC of U.S. convention.
I was.
Tell us about the presentation that you were asked to give there.
So we gave a presentation about a program that we have been doing with Drexel Medical School. They have a HOP clinic, which is a community clinic where students...
The HOP, H-O-P, stands for Health
Outreach Partnership.
Partnership?
I always forget. Project.
I think it's project.
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 You
yes.
did your homework, Bonnie. So the students get training in the community supervised by their physician teachers. And we were selected as one of those sites, which is very exciting.
This is a national program, correct?
It's a national model. And we are the only site that is working specifically with the intellectual disability community, which is very significant because our systems in our medical schools often don't train in how to work with someone who's an adult who might be nonverbal or might not be able to communicate or stand or do certain things in the course of a health assessment. So by having the students there every week doing health screenings, they are learning how to work with all different kinds of folks and with a more neurodiverse population. So it's really very powerful. In the process, they've been collecting data that goes directly to the CDC. And
Centers for Disease Control. There are a lot of initials anytime you get involved with medicine.
So with the Center for Disease Control, they have been using the data to help inform policy, and we found that there's very high rate of some fairly simple things to fix, things like earwax, foot care, And then, of course, the bigger issues around eating healthy, diabetes, heart conditions. So it's been a really amazing process, and Drexel Medical School has been a tremendous partner, as has the nursing school as well.
And the students, the med school students, I've seen them in action. They are so kind and compassionate.
Absolutely.
They are just wonderful.
Mm-hmm. Yeah.
What are some of the other things that they can? So they'll take the blood pressure, they check hearts.
Mm-hmm.
Do they check vision as well?
They do. They check vision, hearing. They're doing a basic health screening and then making recommendations for follow-up with their general practitioner. So most of the folks that they are assessing do actually have a GP, but maybe for many different reasons haven't been able to.
They don't go regularly to their physician.
Or there hasn't been follow-up or follow-through for whatever reason. So this provides just another step and another way to make sure that people are getting what they need.
Let's back up and talk about who the people are with intellectual and developmental disabilities, where they come from, and how the ARC is involved with them at the Spark Philadelphia facility.
So we actually serve people all over the city, but the specific HOP clinic is serving people who are in the cultural arts and the training center at Spark Services, which is a provider organization. We're part of a family of organizations, including Spark Philadelphia, which is the management company, parent company, and we share services, resources essentially with Spark Services. So we're all in one place in
one big place.
One big place
in North Philadelphia.
In North Philly, right near Route 1 and Fox. And it's a really fascinating neighborhood. There's a lot of things going on. Temple's right there with their building. There's a charter school, KIPP Charter, right across the street. And it's actually fairly central to public transportation and other resources.
It's at the Wissahickon exit of the expressway. If you get on at City Avenue, you take the first exit.
Right.
You turn right, and then you turn right on Hunting Park, turn left on Stokely, and it dead ends into the ARC and Spark building.
Right. Now, a lot of people with intellectual disabilities end up being in the lower economic brackets for a lot of different reasons. One of them is not enough employment, not enough supports in our systems. Most of the folks who are at our site have family and supports. They're on waiver services. There are many people, however, outside of our site that don't have all those support systems in place. So we work at the ARC of Philadelphia at a systems and also individual level to identify those resources and help overcome barriers to accessing the quality of life that people need.
One of the biggest challenges is always the school system. And you know, because you're a parent of a young man on the autism spectrum, correct?
Yes, although way before my son was born. I've been involved since 1993 in advocacy in the school district in Philadelphia.
How'd you get involved initially?
Well, initially, my background's in social work and also...
Where'd you go to college?
Undergrad, I went to Georgetown University. And then for grad school, I went to Bryn Mawr, where I got my dual master's in social work and law and social policy. And I've always been very involved in Philadelphia, in the poorest census tracts in the city. And school has always been one of the major needs that our community needs. Nice, strong, healthy school district. And
the biggest challenge that most families face, right?
Well, it depends on your child. The fact is that when you have a child with complex medical needs and complex needs, you have so many different systems that you have to navigate. The school district, the health care system, the behavioral health system, and each one is different and complicated.
And often they don't talk to each other.
That's true. Early intervention services before you even hit school. In some ways, schools are the most resourced and the most straightforward, but even that is very complicated. We spend a lot of time helping to train, support, and sometimes give one-on-one support to families who are trying to navigate the individual education process, the IEP process for a child. There are many wonderful laws protecting our children with disabilities.
And there are many wonderful people, like Philadelphia Councilman Denny O'Brien, who formerly was in the state legislature, who started an autism caucus wherever he goes, and he's one of the chief advocates.
Well, Denny O'Brien's a great advocate for the autism community, for sure, and for the
Yes.
disability community as well.
Oh, yes.
We are very fortunate to have many wonderful legislators.
And they come
who
from
are
both
very-
parties, too. We've
Yes,
got Jim
they do.
Roebuck on the D side. We've got Tom Mert on the R side. So it's nice to know that there are decent people that are advocating.
Right. Well, disability services and disability supports in schools and in life are a bipartisan issue. And the ABLE Act is a good example of that.
We have to bless Senator Bob Casey for the ABLE Act. And I know you were instrumental in bringing attention and public awareness to his efforts to pass the ABLE Act. Explain what the ABLE Act is, Tanya.
The ABLE Act is what allows, will allow, it's in the process, people who are on disability to save money for certain life events, to be able to either take a class, to be able to go on vacation, to be able to visit family, whatever it is they need to do with that little extra money that they can save. It's modeled very much on the savings plans for college, so that it's not taxable. And what happens a lot of times when people are living on disability is they can't ever save anything at all because they have to spend it by the end of the month.
And then they'll lose their benefits.
And then they'll lose, yep. So this is just a way to add a little bit of quality of life. I would say an essential part of quality of life for people.
Let's put the phone number for the Arc of Philadelphia and the website up on the screen. If you want to contact Tanya Regli or any of her staff members, 215-229-4550, 215-229-4550, and it's easy. It's www.arcphiladelphia.org. So if you just Google the Arc of Philadelphia, it'll come up, and probably a million articles as well, I'm sure. Well, so how long have you been the executive director of the ARC?
Well, it's going on 3 years now, so not too long, but not too short.
But before that, where were you before that?
Before that, I was actually, well, I've had many jobs. Before that, I was at Olney High School, and I was running the secondary transition programs there. And Olney has a very large community of students with developmental disabilities.
What does transition mean?
So secondary transition is specifically the transition from school to adult life. A lot of the services that our children get when they have disabilities go up to either 18 or 21. And when those services through the school end, then sometimes if there's not a proper plan, transition plan, we call it the cliff. You kind of drop off and you stop getting the help you need. And it's not uncommon for young people to then spend at least a year sitting at home. We say sitting on the couch,
watching television.
Unfortunately,
yes.
waiting for life to start up again and
Yes.
for the services to be put in place, because there's a big difference between the way the school systems work and the systems in adult life. In adult life, you really have to apply and you have to qualify. They're not mandated the way school is. So a lot of times, if you don't have a good secondary transition plan, life afterwards gets pretty difficult.
And boring.
At the least, that would be the minimum. Unfortunately, sometimes people end up homeless. They end up in severe poverty. They end up isolated. There's just a lot of really difficult things that can happen to somebody. For secondary transition during high school, when you really have a lot of resources together and you have someone coming to school on a regular basis, you can put a lot of things in place to make sure registration for certain resources after you graduate. You can also spend a lot of time making sure things like travel training happen, that a young person knows how they're going to get around and get to their job. You can help them start working. We're really pushing through the I Want to Work campaign, which is it's a social media campaign that really was started by some folks in Pittsburgh from the United Way. And it's a fabulous campaign to work to make sure that students get a chance to work before they leave high school, get paid employment before, because really that practice is so important to being able to sustain and maintain a job after you graduate.
There are a lot of things to learn after you leave high school.
There are.
And you have to learn how to dress, how to fill out an application. There's always a problem with interviews, but you have a number of staff people. What happens when somebody calls you, help?
Right. So if someone calls and has a child who maybe isn't getting enough supports in school, or maybe they suspect that the child has a disability and they haven't been evaluated, those are the kind of things that we have an advocacy coordinator who will do the initial call, and then we have a couple staff who will then follow up and work with the family to help find the supports that they need. And that might be something very concrete that we can send and help, or maybe there's a meeting that we can have with the school to help support the family. So there's a lot of different ways that we support folks.
There were a lot of parents who are very grateful that someone from the Arc of Philadelphia accompanied them and their child to a meeting with the school district.
Absolutely.
Because it doesn't always go the way the parent wants it to go.
Well, IEP meetings can be very stressful, and they can spend, you're focusing sometimes a lot on what's not happening instead of the positive things that are happening. And it can be really key to have supports. There's also so many different legal issues and rights that you have. We focus a lot on helping make sure that the families we're working with also learn how to manage the process. And we also focus a lot on helping to make sure that youth with disabilities learn how to manage the process too, because ultimately that ability to self-advocate is going to be key in whatever happens after school.
One of the things that I most admire about the ARC and the other associations under the same umbrella is that you encourage and you allow universities to send student volunteers to teach basic courses, how to handle a budget, how to deal with money. I haven't sat in on those classes yet. I've just seen what they put on the blackboard, so I know what they're doing.
Right.
They call it Hawk Chalk, the St. Joe's volunteers, right?
So we have a lot of resources around money management. Quite frankly, almost everything we're talking about is good for any young person.
That's true. That's true.
And a lot of the focus of what we look at and the focus of the ARC of Philadelphia is on inclusive practices and universal design. So the idea that if you're going to design something, just like the difference between a ramp and stairs, you can put stairs in, but if you just put a ramp in, then everybody can access.
Use it.
So it's not
That's a good analogy. I like that.
It's not too dissimilar, quite frankly, in school or employment. A lot of times things that we're doing that aren't working for an employee with a disability or a student with a disability isn't working for some of the staff either. So by adjusting it and doing it so that it's a universal design concept, you kind of kill two birds with one stone. And that's one thing that I think I've heard a lot from teachers and from employers who have been going through this process, is the learning for the whole community and the improvement for the environment for everybody. And that's the power.
And I like the phrase that I've heard you use. If you've met one person with autism, you've met one person with autism. You can't generalize, because it's not the same description from one person, just like each one of us is unique.
Right.
Each person with a disability is unique as well.
Right. Well, we call it it's a spectrum disorder. It's a big umbrella of characteristics that we put together. One of the reasons we put things together like that is in order to get certain kinds of services, it's important to have a certain number of people. So it makes it easier to push certain policies and things forward. But the fact is, we're all individuals, and we're not identical. None of us are. And that goes for a person with disabilities as well. Sometimes we think all people with autism are good at mathematics or computer programming.
If they saw a Rain Man, they think that's everybody on the autism spectrum.
And there are certain things that do tie people together, which is why they have that particular diagnosis. But the fact is that there are phenomenal artists and phenomenal, when anywhere you look in society, there are people who have autism who are good at that particular thing. One of the strengths that many people with autism do have is an intense interest in something, whatever it is. And oftentimes, when you're intensely interested in something, you develop some pretty darn good skills in it. So that can be a real gift.
And the focus, the ability to focus intently, although unless the people surrounding that person are educated or enlightened to know it's okay for this person to be totally focused on this particular task or this particular subject, it could be a little disconcerting sometimes, right?
It just depends on the person. I mean, there's also folks on the autism spectrum who are very outgoing and social and
verbal.
Yep, some people are very verbal, some people aren't. It's just, the whole range.
If you had a magic wand, what thing in society would you change immediately?
Oh my. I would want equal access to resources for people with developmental disabilities. And we need to improve neurodiversity throughout our culture and throughout our life.
There are 14,000 people on a waiting list right now
There
for
are.
services. 14,000 in the state of Pennsylvania.
And that's just the people who got on the waiting list.
Yeah,
Because there's many people with ID who never get on the waiting list. And the waiting
their parents
list
are taking care of them. But the problem is when the parents either die off or become infirm and they can no longer take care of an adult child with a developmental disability, the services aren't there in the community very often.
Right. So one of the things we've been working on, there's a state and national movement right now on family supports and the need for planning in terms of what we're going to do as aging parents either cannot no longer take care of their older adult children with developmental disabilities or have passed away. And there's some complex issues that we're working out, things like how to have reciprocity between states when an adult child loses their parents and needs to move to be with a sibling in another state. Each state has different ways of providing services.
Or not providing.
Or not providing.
I don't want to point any fingers, but...
But each state has different ways of providing those services and ensuring that you can cross state lines and still get the supports you need while being with the family that ultimately, a lot of times families are the linchpin to those long-term supports, siblings included.
Nancy Thaler, who is back in Harrisburg in the Department of Human Services, luckily for us, because she's a longtime advocate and a parent and an administrator, and I heard her speak at a conference recently, and she said, well, let's be realistic. The families are the caregivers right now. The main caregivers are family and family members.
Yes, they are.
But you've got 14,000 people on a waiting list. The need is now, not in the future. It's right now, today, this afternoon.
Right, and if I could get rid of the waiting list and the interest list for the autism waiver, and just have the services that each person needs to be able to have a full and productive life.
And pay taxes. And they can work and pay taxes.
And most people want to work. There's when I was at that high school, I became known as, quite a few of the students would approach me because they knew that I was getting people jobs. And they were like, I want a job, I want a job. So people want to work for the most part and need the support and maybe the initial opportunities to be able to do so.
If you're interested, you can call the ARC of Philadelphia, 215-229-4550, 215-229-4550. You can Google www.arcphiladelphia.org, and you'll get a lot of very useful information. Our guest today has been Tanya Regli, the Executive Director of the ARC of Philadelphia, and we'll see everybody next week.
Great. Thanks for having me.